thank you all for having me here. I know there's at least one other agricultural economist in this room just because he's from my same department. So, but when we talk about branding, somebody said branding. So while I'm an agricultural economist, the reason I'm an agricultural economist is because I knew I could never go back to the farm. Why? There's 6 siblings in my family and I am the 4th daughter, but I am the 5th child. So there was pretty much no way I was going back to the farm. So what can I do to help my family's farm, right? And becoming an agricultural economist was kind of that route that I could take. And so when I look at research, I've done everything from production livestock economics to insurance to risk management and a lot of other research looking at consumer preferences, right? And so a lot of the questions come up as, you know, what are things going on within that entire supply chain? Right? And the big thing on the consumer side, as we look from an economics piece, is we are not homogeneous, right? I think we showed with the climate change piece, right? All consumers are heterogeneous. And we're going to talk a little bit about some of the knowledge and those acceptances, as we go through. So that's kind of a little bit on the background is just, you know, as we look at this information, trying to realize that all consumers are different and we do things for different reasons. So one change, in your handout, it says, does ignorance keep us informed? We're going to change that and say, does ignorance keep us uninformed about antimicrobial resistance? So my first question to all of you, we're going to use Slido as we go, but I didn't throw this one in there. How many of you have ever willingly avoided information? Why? What? The information you thought would be too negative? Okay. Overwhelmed? The source? Not sure what to do about it? Thought I already knew? Good. We're going to see that. Anybody else? Those are all good reasons, right? There's always reasons why we may not want to know about something, okay? I'm pretty good about ignoring the calories on those chocolate bars, right? I really like to eat chocolate and I don't really care what's in it because to me it tastes good, right? So I'm willfully ignorant as to what's going into those. All right. So I need to thank a few people. We had a postdoc, Dr. Imran Meraza, as well as Chris Gustafson and Emmy Yanka. Those are 2 other faculty within our department. And I'm also going to plug our ARD Center and U.S. Mark Research for their contribution as far as funding this project. So making sure I put plugs in for the help in this research. So where did this come from? Well, actually, U.S. Mark and ARD came to us talking about communication of antimicrobial resistance and antibiotic use to producers and to consumers, right? We know that antimicrobial resistance is an issue, right? How big it is. I'm going to bring in the cost because I'm an economist, right? We can look at the healthcare system. It's about $20 billion, with indirect costs as high as $35 billion, right? And we're assuming it'll continue to grow. And so educating the public about AMR, that's why we're all here, right? That's the reason we're all here is to understand antibiotic use and antimicrobial resistance. So the big issue that we saw, though, was little was known about our public's knowledge of, their attitudes towards, and their use of antimicrobials in livestock production, right? As well as antimicrobial resistance, right? What is that baseline? So when we're going out to communicate, right, what knowledge do they already have? Okay. And so that's kind of where this all started. So I don't have the third objective. It's going to be a surprise for you. But we have our 2 main objectives. The first one was just looking at the knowledge of, the attitudes towards, and the acceptance of those antibiotics and antimicrobial resistance. So we wanted to know what factors are going to affect the acceptance of antimicrobial use in livestock production. So when we talk about use, we're going to give 4 uses in livestock production. So the promote growth, to prevent disease, to control disease, and to treat disease. Okay. The second piece is looking at our subjective and objective knowledge, right? Looking at our subjective, our self-assessed, and our measured knowledge, which we'll talk about a little more in a little bit, and how that impacts our acceptance of the use of it, as well as our general knowledge and whether or not we will avoid information or not. Okay, so kind of just a few steps walking through here. We collected this data in May and June of 2018. We used a survey firm, so we created this survey. As ag economists, we did not write all the questions. We had help from microbiologists, veterinary scientists, who also vetted the survey before we sent it out, just making sure we had the right information, especially on the knowledge survey part. It was divided into two sections really to address those two broad questions, okay? So the first piece that we gave to the consumer or the participants was asking them their level of acceptance of the different uses. So they were given 4 questions here, and on a 5-point scale, they were asked to rank whether or not they felt it was totally unacceptable, all the way to 5 being perfectly acceptable, right? So asking them about treating infections, controlling infections, preventing infections, and then using it as a growth promotant. So I'm going to switch to Slido, and what I'm going to ask you is not your acceptance of it, but what do you think consumers ranked as their acceptance for the different uses? So the first one is what you think their level of acceptance is for the use to treat infections. So it's looking like acceptable. Majority of you feel that the consumer thought that treating was acceptable. Okay? Hold on to that for a minute. The next question is going to ask you about controlling. Those were not defined for them. So the level, this one's prevent, I'm sorry. So you can change your answer if you want to. I think you can go in there and change it. So the level of acceptance for preventing is most of you are saying it's unacceptable, but not quite to the height that we saw treating being acceptable. Okay? And then we have a next one. I'm not going to guess which one it is. I assume it's control. So it is control. Okay, so we're kind of split somewhat, but the neither acceptable nor unacceptable is kind of winning out there at 44, but still a higher of the acceptable. And the last one is to promote growth in food animals. So most of you were sitting at 96% saying unacceptable, that consumers thought the promoting growth was unacceptable. There's a few saying acceptable or neither acceptable nor unacceptable. Okay, so what actually was shown by the consumers is when we talk about treating infections, right? You guys were kind of up there. We had a little less, but about 61%. We're okay with the use of antibiotics for treating infections. The next one on controlling, right? You guys were kind of more saying they'd say neither, one or the other, but about 54% would control, and be okay with that being acceptable. The prevent infections, what we saw there was kind of a third, and a third if you really want to look at it that way, right? We had, about a third saying acceptable, about a third saying unacceptable, and about a third in the middle. The last one is promoting growth. And I'll remind you, these were on a 5-point scale. And the reason I'm reminding you that is because of that 58% that said growth promotant was unacceptable, 60% of those were totally unacceptable, right? So majority were saying that promoting growth was totally unacceptable. That's really the only category where we saw that kind of showing out one way or the other. But we did combine those then into those three categories. Yes, ma'am. 1,030. So it was geographically U.S. represented. So it's an IRI is a national survey firm, and they guarantee geographically representative. So yes. Excuse me. Sorry about that. Okay. So that was just kind of our first set. We want to know, what is their acceptance? Are they okay with us using it, right? We do see on majority of them, they're okay with us to use it for treating, controlling, and potentially even preventing infections. But what we want to do is really what is impacting their acceptance of those, right? Are there characteristics of those consumers, right? We're going to break these consumers into groups, right? What is it about the different consumers that make these things more or less acceptable? Okay. So we wanted to assess the level of acceptance for the different antibiotic uses, okay, of the prevent, control, treat, and promote. So we had several independent variables. The two that I'm really going to talk about is knowledge today. Okay, so we're going to talk about subjective and objective. I'm also going to talk about the concern variable a little bit, but the others were really just included for control variables, all right, in our analysis. So the self-assessed knowledge, your subjective knowledge, was basically using 6 questions. Okay, so on a 4-point scale, the participants were asked as to what they felt their knowledge was of these different categories. Okay, so they're self-assessing their knowledge of antibiotic use and AMR. So how much do you know about the use of antibiotics in livestock production, about antibiotic resistance in humans, in animals, about drug resistance, antibiotic resistant to bacteria, and their knowledge about superbugs. Okay. What we did is we didn't include each one of these separately, but we created an average score for everybody as to whether they felt they were not knowledgeable or knowledgeable on the subject. Okay. So we're going to switch to Slido, and I'm not going to ask you each one individually, but in general, what do you think the average or the percentage rated themselves as having no knowledge or little knowledge about AMR and antibiotic use in livestock? All right. So what we have in coming in is about 32% saying 25 to 49% say they have no or little knowledge. About 30% of you think that about consumers less than 25% said they had no or little knowledge. And about 27, so a third and a third and a third, if you guys want to kind of round here, said between that 50 and 75, right? Those of you that thought consumers over 75% said no knowledge. Why? Nobody's going to talk as to why. I one time told my students that in college, my juniors and seniors, it's a lot funner to go talk to kindergartners. Why? Because they have all the why questions, right?
So we won't call anybody out, but all those people that didn't answer over 75%, raise your hand. Okay. Now I can find out who did. Keep them up. Anyone want to tackle that?
Why do you think over 75% said no knowledge or little knowledge?
So when I've had conversations around the Thanksgiving dinner table with friends and I talked about antimicrobials, they would ask me, what is that? I don't know what you mean. If I said antibiotic, they, didn't question that term. So I guess I think there's not a lot of knowledge among consumers about some of these technical aspects of antibiotic resistance.
Anybody that said closer to what was the other end? The less than 25% that you thought they said they had lots of knowledge? To admit what they don't know? Okay. What we saw, oh, I have those in there for reminders. So I have these broken out for you across, right? So if we look at the use of antibiotics in livestock production, right, their self-assessed knowledge is somewhere between no knowledge and little knowledge, right? Antibiotic resistance in humans, they might feel that they have a little more knowledge there. Drug resistance, again, still that little to no knowledge. The big one that they said they had little to no knowledge of was antibiotic resistance in animals, right? I think we're more and more, we've talked before, disconnected from the farm, right? And so they may not understand the antibiotic use or resistance in animals. There was kind of a third on the antibiotic resistance bacteria, and then on the superbugs, again, pushing more towards that no knowledge. So in general, on average, 67% self-identified with little or no knowledge of AMR and antibiotic use, right? So most of you are pretty close, right? We're pushing that 70% of consumers saying that they self-assess as to not having knowledge in these areas, okay? So something to think about when we're trying to communicate, right? If the consumer has no knowledge or they feel they have no knowledge, right? How do we communicate that knowledge then to them, okay? The other side, and my apologies is that this is a little small, on the objective knowledge, so this is where we are trying to measure their actual knowledge level, right? So these were, again, with the microbiologists, veterinarians that work in antimicrobial and antibiotic resistance, true-false questions as far as antibiotic use in livestock production and AMR. So we had the first 5 really about antibiotics being common drugs to treat bacteria, treat viral infections in humans, same thing as in food animals, or treat any kind of pain or inflammation. And then on AMR, we had several things about antibiotic resistance occurring when bacteria become resistant. The overuse and misuse accelerates it. Overuse and misuse in animals doesn't cause antibiotic resistance in humans because we don't use the same drugs. Antibiotic resistance existed before human development, and then antibiotic resistance has been found in every environment. So again, we just use one level here as far as knowledge. So everybody's taken a test before, right? We can get a percentage for you as to how many correct you get divided by the total, and that would be your percentage score, right? Whether you got the A or the F in the class, okay? So my question for you on Slido is, how well do you think consumers scored? So what is the percentage you think as far as their knowledge of AMR? What is their score? So basically, what percent do you think got correct? All right. So most of you are saying 25 to 49% got them correct. Okay. Some of you saying less than 25. I should have asked another question. What do you guys think you would have scored on that test? Maybe that's what I should have. Anybody think they would have got 100 on that test? Yeah? Okay. Hopefully. All right. So what we can see here is, on average, the score was 40%. Okay. One thing to note when you think about this is if they would have just randomly selected, it would have been a 50%, right? And so they're less than randomly selecting. Okay. So on average, our score for objective knowledge or measured knowledge was 40%. A few that I want to point out is 2 that I'm going to kind of highlight here, is that antibiotics are common drugs useful in treating bacterial infections in humans. 75% got that correct. That's pretty big, right? That's good that they know that. And 70% got that overuse and misuse of antibiotics accelerate antibiotic resistance. Okay. Now we have to have some positive and negative here to get some true and falses. But the one that got the lowest score is antibiotic resistance existed before human development of antibiotics. Right? That was a true answer, but only 19% got it right. So a lot of them are thinking that it's happened since we've created antibiotics, right? There was a study that we saw yesterday or the day before, right, showing that it's well before we ever created those antibiotics, okay? So it's a misconception that is out there, all right? Excuse me. All right, so when we look at subjective and objective knowledge of AMR and antibiotic use in livestock, sorry if I start shortening that and don't always say AMR and antibiotic use in livestock. This is just putting your subjective and objective knowledge together. So basically, to get no knowledge, little knowledge, moderate knowledge of the objective, we had to kind of break things as far as, if you scored low on your exam versus high, you would be basically given a grade. But what you can see is they fairly move together, and we can look at it slightly differently, but we have that positive relationship. So those that felt they had more knowledge tended to have more knowledge. Those that felt that they didn't have much knowledge, right, also were showing that they didn't have much knowledge. So they were pretty truthful in what they felt in this instance, okay? Sometimes we see where we self-assess ourselves and it's not right? We either say we know more than we actually do, or we say we don't know much and actually know more than we do. But here in this instance, things seem to work fairly similar, which impacts our results as we go forward. Okay. One other descriptive statistic I want to bring to your attention that we used was a control variable, as well as that was the level of concern, right? So what is the concern that they had for different things as far as antibiotics and antimicrobial resistance, okay? A little bit different than their acceptance of something, okay? So these were on a scale of 1 equal not at all concerned to 5 being extremely concerned. And what you can see is most of these are in that 3 to 4 range of somewhat moderately concerned. Things like the use of antibiotics to promote animal growth in food animals, or the use of it to promote growth, about the using of the same antibiotics in humans and food animals, the use of antibiotics in production that might contribute to antibiotic resistance. The one that got the lowest score was the use of antibiotics to treat infections, right? They had less of a concern about that. Okay, so just a few things to look at. Now, when we include this into our analysis, and we're not going to talk about the impacts a whole lot, but we did do a factorial analysis for any of you that know that put those into categories, right, as far as concern versus each individual statement. All right. So our key results, when we're looking at the factors that impact our acceptance of antibiotic use in food animals, right, the greater our objective knowledge of antibiotic use in AMR, remind you, only 40% had a lot of knowledge, only 40% had a great amount of knowledge, right? Most didn't have a lot of knowledge there. The greater, though, the objective knowledge, they were more likely to accept antibiotic use to treat and control, and those that knew more or had a higher objective knowledge were less likely to accept it for preventing disease and for promoting growth, okay? So just a little bit difference in our actual knowledge, right? But if we do have higher knowledge, we were more likely to accept it to treat and control than those with less knowledge, okay? Those with high levels of concern about AMR and antibiotic use in livestock production were less likely to accept antibiotic use in food animals, right? That should make sense, right? If we're concerned about it, we're probably a lot less to accept it as a use, okay? Those who believe that antibiotic use improves animal welfare were more likely to accept antibiotic use in food animals. If we assumed it reduced animal welfare, we were less likely to accept it, right? That should also make sense. If we think it helps animal welfare, we should accept it. If we think it's going to cause harm, we'd be more likely to not accept it. Does that make sense? Okay. And then we did have a little bit of difference between females and males. Females, were less likely to accept any form of antibiotic use in livestock production compared to males. Okay? All right. Questions over that and the acceptance use? There's a quick one. Otherwise, I'm going to move to my second objective. Okay. So the second objective that we were looking at was really assessing the role of this subjective and objective knowledge in AMR information avoidance behavior. Okay. So we really want to know, if we have knowledge, are we willing to accept that information or not accept the information, right? Is there a driver there that causes us to be willfully ignorant or not, right? We've all said we've been willfully ignorant at some point in time, but when we're looking at antibiotic use in AMR, can we figure out what's causing that, or does that cause it? Okay. So in this section, they were given a video selection, and all they were told was, you can watch a video. Both videos are 3 minutes and 35 seconds. Once you select a link, you will watch the video, and then you will continue on with the survey, okay? You cannot go back after you select a video. So the two things they were given was a title saying antimicrobial resistance, the role of food and agriculture, The other video, nature white noise, rain and thunderstorm sounds for relaxation. All right. Your first Slido question. What would you choose? I believe is what my first one is. Yes. So which of the following two videos would you choose? All right, so 60% are going to choose the antimicrobial resistant video, and 40% the nature white noise. So we've freaked you guys out, and you just want to relax. Why are we watching the relaxation video? We don't want to know the truth? You already know it? Why are some of you choosing the video? You're going to do other things while it's playing? What I chose? Go to another Slido question. I think the next Slido question is, what do you think consumers chose? So what percentage of consumers do you believe chose to avoid obtaining information? So what percent do you believe watched the white noise video? What percentage watched the white noise video? All right, sorry, I'm taking a note real quick. All right, so most of you, over 50% of you, said that 50 to 75% of them watched the white noise video. Okay? We're going to watch the video and then I'll give you the results. Can you click on that for me? Huh? Yes. So this is a 3-minute and 35-second video. I'm sorry, but...
Public health and sustainable food production are facing a serious global threat today. The increasing spread of antimicrobial resistance. Antimicrobial resistance refers to bacteria, viruses, fungi and parasites that become resistant to antimicrobial drugs. How do microbes become resistant? Antimicrobials such as antibiotics are used to kill or stop microbes from growing in humans, animals and plants. Antimicrobial resistance can occur naturally over time. But overuse and misuse of antimicrobial drugs in humans and in agriculture speed up the development of antimicrobial resistance. As a result, the medicines we use to treat common infections are becoming less and less powerful, or even useless. How does antimicrobial resistance spread? Microbes that are resistant to antimicrobials can be found in people, animals, food, water and the environment. Antimicrobial resistant microbes can spread through the food chain and the environment, between people and animals, or from person to person. Antimicrobial resistance affects human health because drugs become less effective, leading to more severe illnesses, with an estimated 700,000 human deaths each year. Food supply and agriculture, because production losses lead to food insecurity, and because misuse results in unsafe or contaminated foods, and affects the environment, with soil and water polluted with drug residues and resistant microbes. What is needed? A global threat requires a global response. Bringing together all people and sectors to reduce the use of antimicrobials in humans and animals, and to use them selectively, prudently, and responsibly. A global threat requires a One Health approach, with all sectors working together. Veterinarians, prescribing medicines responsibly, and only after a proper diagnosis, and advising whenever possible alternatives to antimicrobials like vaccines. Farmers, through common and good farming practices, and a responsible use of quality antimicrobials, only on professional advice. Food producers, producing, handling, and marketing food under hygienic conditions in a proper and environmentally friendly way. From global commitment to local action, FAO supports national action plans involving all sectors to prevent the development of antimicrobial resistance by raising awareness, promoting best practices in food and agriculture, including aquaculture, developing capacity for surveillance and monitoring, and always making sure that rules for the safe use are respected. If we use antimicrobials in agriculture responsibly, we support sustainable food security and save lives.
How many of you had seen that video? So that's publicly available on the FAO website. So we were brought to our attention as, suggested of a use, when we're looking at antibiotic use and antimicrobials, we can debate the issues that may potentially be in it, right? But that's the video that we were given as far as a good one to look at, for antimicrobial use. Okay. So how many actually chose to watch that? Okay. Oh, my Slido thing. Actually, one more Slido. I forgot about this one and it's an important one. Why do you think, what is the main reason you think consumers chose not to watch it? So not why you chose not to, but why you think consumers chose. Yes, sir. I guess I didn't say a good video to watch. I'm saying it was a video that somebody shared with us, saying it was a video that we could use to inform antimicrobial use and resistance within our survey. As far as linking One Health. It was brought to our attention by a microbiologist and a veterinary scientist.
Okay, I don't mean to open a can of worms here, but I'm going to,
good.
because that video pointed the entire problem at agriculture.
And did you, that's what I said afterward,
so much
that we could discuss
inaccurate information in there, including something as simple as the cow pooping almost directly into the water. And there's just a lot of bad information. And from an agricultural standpoint, I wouldn't promote that video to anyone.
And we're not promoting it. I'm saying it came from FAO. We have to have a video. Our big thing was, were they going to look at the video or not, right? Based on the wording, the antimicrobial resistance.
Correct. And as we talk about communicating
Yes.
the right message,
Yes.
the message needs to be, as we talk about a lot, balanced, accurate, and truly informative.
Right.
So that we're looking at this from a One Health approach, and the human side of that never came up.
I know. And I'm going to show you something here in a little bit as well as far as you're getting into my third point, my third objective, right? How does what we communicate impact their change in their perceptions, right? And you're good. No, when I first saw that, I'll tell you the truth. I saw the missing of the One Health as well, right? The human connective. But again, we were focusing on animal agriculture. And so that's where they pointed that at. Yep.
I think it's challenging when we select things that are developed for the global community and try to use those to inform or have a conversation about what we do in the U.S. Because there are many, many differences with regard to risk of AMR, with regard to the epidemiology of AMR, both in people and animals.
Right.
So I think maybe that also is a piece that's at the heart of maybe selection of the video. In addition to the fact that it wasn't
they did not know what was in the video. They did
Right.
not know who produced the video. All they knew was a title.
Right.
And so that's really what we're looking at, is that title there.
And I just want to add I know Dawn's in the room with the CDC. It's not always clear who helps develop these videos. And so working really closely with the CDC, we have regular barnyard calls. When they develop materials, they get our input. So if they were to develop, I thought the animation from that was really good, but like you said, maybe some of the messaging was off target. So that just kind of speaks to really needing a One Health approach and getting input when you develop it.
And we did. So we had microbiologists and veterinary scientists that had looked at it. So,
no,
I'm not throwing back under,
and it's not your video.
It's not our video.
Well,
so,
right.
and but I think it leads back to that thing that we've had discussion before is what information is out there, right? We had that discussion yesterday about what was the first image that popped up, right? What is coming up? If there's differences between international, antimicrobial and antibiotic use, Lee and I had that conversation earlier, right? That what is it going to the consumers? What information are they getting first, right? And where are they getting that information from? Because for them to understand the difference between U.S. production versus other countries. Oh yeah, you want to go on? Good. Okay.
Can I just since Heather called me out, so Dawn from CDC, and thank you for doing that. I think, and again, this is just to bring this point to get all of your feedback, in awareness of one of the things that I've picked up in our conversations and specifically been helpful talking to the Barnyard group is when we create an infographic or a video, it always has to be, because it's communication, super short, to the point. The videos have to be quick. Beyond 3 minutes, people stop listening. And so we struggle to pick the audience that particular infographic is for. And so, for instance, just in defense of FAO is that they are food and agriculture. So they're not going to focus on healthcare in the hospital. If they were going to make a One Health one, which is great, you would have to go off into every single angle and include everything. It becomes a way more complicated infographic or a longer video. So having your input and your thoughts on that is helpful for us, because I know we've been asked at CDC, why are you just blaming food industry when really there's just as many or more healthcare posters as there are animal, but they're separate. And so I'm gathering, and I hear that it becomes an issue, but then how do we uncomplicate the full picture and get some level of detail if we're trying to do One Health in every sector? That's why they get broken up, but admittedly that becomes a problem. So it's a struggle.
And I'll agree, even with the survey writing, right? And our focus, if we start going out of just the food and agriculture and getting into the combination of connecting it with One Health, right? The survey gets longer and longer. And how many of you like taking a very long survey? Right? And so that adds to that difficulty.
And to that point, the actual purpose of this was whether they watched the video or not, correct?
Yes.
Okay.
Yes.
That's where we're at.
The purpose really was, would they watch it or not? Okay. And so you guys said, which of the following statements do you believe is the top reason why consumers chose not to watch it? And you said, I would rather not know more about it because there's nothing I can do about it. Watching a video is not going to change my views. I fear that knowing more about it will make me feel anxious. There are more important issues, and I know enough about antimicrobial resistance. All right. We can go back.
I just want to go back to the video and kind of talk about Dr. Sievert's comments just a little bit. I think the biggest concern here is, one, the image that's portrayed, and I understand taking up for FAO and what they're doing, and it's not the One Health promotion that they were doing there, but there was One Health all over that video that pointed the finger at animal agriculture the entire time. My Slido question, which every time I ask a Slido question, obviously I never get an opportunity to have that question up there, is I never saw a doctor anywhere in that video. And so if it's going to put the One Health thing on there, and we're all on the same team here, then why are we not saying doctors overprescribing antibiotics also contribute to antimicrobial resistance? That's the frustrating point to me, because even if we use that just for a test to see if consumers would watch the video, now they've watched that video and they get the message that FAO says that it's all animal agriculture that's causing the problem. And so even if only 50 people participated in this, now you have 50 more people that think that message is FAO says animal agriculture is to blame. That's the frustrating part. And if we accomplish nothing else over these last 3 days, if we don't come together as a group and say, whenever we present something to the public, it has to be a unified message between doctors, animal agriculture, and consumers, we're always going to get the blame on the animal agriculture side, because what a consumer sees the first time is what they remember the very last time. It's not everything else in the process. It's what they see that first time. And that message right there is what they got to see. And that is frustrating.
Okay. So, looking at just antimicrobial resistance, the role of food and ag, or white noise, what we found is 40% of our respondents avoided the AMR video. Why did they avoid that video, right? Why did they choose the title of white noise? 31% said watching the video would not change my existing view. Now, again, we don't know what that existing view was, whether or not they felt they knew enough about it or they didn't know enough about it, but they said it wouldn't change their existing view. So when we're thinking about, what was it coined yesterday, the movable middle, these may not be the movable middle, right? We don't know which side they're on, but these people aren't going to change their view, no matter what information we give them. The other top ones up there is nothing I can do, at 20%. Scared of knowing about AMR was 21.6%. Now again, they could choose more than one option, so these don't add up to 100, as well as what I made you guys do. The one interesting one that I'm going to point out is 15.3% said other. What did that other say? When we look at just a video about just saying something about antimicrobial resistance, right? The role of food in agriculture. They said other because I support Trump. So that's why they chose the white noise video. They said other because I only eat healthy food. So they didn't want to watch the video. Right? They said that I was afraid that it might show animal abuse. Right? So again, as we're thinking about how we coin things, right? All it said was antimicrobial resistance, the role of food in agriculture. And somebody assumed they were going to see animal abuse in it.
And I'm sorry, 42% are afraid and unempowered, not empowered. That's a huge group that are just, it's fear and I can't do anything, and that's a group I wonder if, can you work with, or do you just go after, something else? That's a lot. To me, that's a lot of people, so.
Yes. Yeah, and we don't know how many of them said both of them, right? I can go back and pull that data as to which, whether they said one or the other, but seeing both. But yes, you're right. That fear that they don't want to watch something because they don't think it can help, right? That they can't do anything, that they're too small, right? To make a change. Okay. When we're all talking about One Health, and it comes down to all of us, right? Making those differences, not taking that antibiotic when we don't really need it, right? Don't go screaming to your doctor, or don't give it to the animals if they don't need it, right? And using it more responsibly. So making sure we kind of address those issues in that communication would be good. Okay. All right. So I kind of gave you the backwards way. Usually we talk about our literature review and things before we give you the information, but then you guys would have known the answers to some of this. So one thing when we think about information and economics is, as far as economics, we believe information is valuable. Good information is valuable, right? And should improve our decision making. Okay. We usually assume that rational agents wouldn't avoid valid information unless ignorance is our strategic behavior. Okay. There is research that say consumers do value and seek this information, and they're willing to pay for even useless information, right? That we seek information, okay? And there's growing literature in economics, psychology, neuroscience, that people also avoid information even when the information is free and could improve their decision making, right? One example of this is if you think about the financial markets. If you look at your financial portfolio, a lot of people will look at the financial portfolio only when the markets are going up, right? Ooh, I'm getting more money. But when those financial markets start going down, we tend to avoid the information, right? We don't look at those, okay? And so even though the information's free, right, we're not going to look at it because it's a different situation, all right? So information avoidance is any situation in which we choose to we do not obtain information that is available and free to us. Previous literature shows that there's responses to potentially uncomfortable information is very variable, right? So all those responses I had listed for you guys really come out of literature as to reasons why people would avoid it. And so then they were given all those different options, right? A lot of it being scared, right? We don't think we can do anything about it. We don't care, right? We don't know. Okay. So our objective then was just to really examine the role of our subjective and objective knowledge, right? What knowledge we feel we have and the actual knowledge we do have about AMR and antibiotic use in livestock production, right? Because when we look at a lot of the information avoidance papers, they don't look at anything to do with knowledge, right? So if we have knowledge, do we seek out more knowledge or do we seek out less knowledge? Okay. Again, reminding you subjective and objective knowledge moved in the same relationship. Okay. So what we find, and I don't have a pretty graph, I just have numbers, is basically, and you got to remember, no or little subjective knowledge, right, is 1 or 0. So it's 2 categories. Either 1, they knew very little, or 0, they knew moderate or a great deal. Okay. And objective knowledge is on that scale from 0 to 1, right? It's a percentage of how much knowledge they have. So they're opposite in doing this. Can't get my colleagues to switch it for me. But the no or little subjective knowledge basically means that if we had no or little subjective knowledge, we were more likely to avoid the information. So those of us with more knowledge were willing to watch the video. Okay. The other side is the objective knowledge. Same thing. If we had little objective knowledge, we were more likely to avoid it, right? If we have more objective knowledge, right, we were more likely to actually watch the video. Okay, so knowledge was showing us that we were more likely to watch the video, the higher knowledge. Okay, and then we did have some control variables in there as well. One thing, and I will note, participants did re-answer 4 questions related to perceptions and understanding. I'm bringing this up. I'm kind of scared to bring this up after some of the conversations. But I think what's coming to say is that information can be powerful, right? Whether it's a good information or we feel it's bad information, it can change our perceptions. It can change our understanding, right? So we did have 631 of the respondents, right? About a little over 60% chose to watch the AMR video. Everybody re-answered the questions whether they watched the video or not, right? Those that did not watch the video, their answers really didn't change, and I can give you information on that if you want later. But of those that chose to watch the information, we saw changes in their acceptance of comments. Okay? So the first one, whether AMR was a big problem that the world faces, okay? They said that their acceptance of that went up. Again, from 1 being strongly disagree to 5 being strongly agree. Okay. Widespread use in animal feed can lead to antibiotics polluting the environment through ag runoff. Right. You guys saw the video. We could see that that would increase that. Antibiotics creates new resistant bacteria. Okay. And the last one is the use of antibiotics in food animals does not cause AMR that could affect humans. Okay. That's an opposite switch there because it's negative versus positive compared to the others, right? What I'm just going to say is if we combine those, it impacts our agreement with those statements, right? It significantly changed our views based on the information that we saw, right? I'm not going to argue whether it's right information, wrong information, anything. What I want to point out is it changes our views and our perceptions. As an economist, it changes our likelihood that we'll purchase something, right? If it changes it in a positive way, we might be more likely to purchase it. If it changes it in a negative way, we're less likely to purchase it. Okay. So understanding that with that information in general, it changed our views. Okay. Then those with little knowledge, whether subjective or objective, it changed their knowledge the most. Right. Or not their knowledge. It changed their acceptance the most. Okay. So those that already had knowledge were less likely to change their views. Does that make sense? Okay. So overall, with all 3 objectives, participants with higher objective knowledge, again, objective knowledge wasn't that high, were more likely to accept antibiotic use to treat and control disease, but less likely to accept it to prevent disease and promote growth. There was a positive relationship between our subjective and objective knowledge. Those with little or no knowledge were more likely to avoid information, but if they chose to watch it, they were the ones that changed their acceptance, right, more, or changed their perceptions and understanding more, okay? So, what we're looking at, right, as we do this, and yes, I am happy to talk to any of you as we go forward. As we trying to understand, how do we encourage those that are willfully uninformed individuals to actually access that information, right? If they're scared or they don't think they know enough, how do we get them to access that information? Is there something about it? Can we have different forms of information, right? Again, we've talked about that statistical versus story-based. There's some research behind that, right? Can we look at different information sources? So there's research looking at, whether they get it from a NGO or a government or an activist, right? And whether or not they're willing. Again, it's depending upon their background as well, why they would take it. I talked to Leah a little bit ago. Excuse me. She has a really nice video. And if you think about it, she's a farmer. She's a veterinarian. She works for a company, right? What else did we say? I don't remember. But you could take that and look at, giving them the exact same information from the same person, but does it matter who it's from as to them choosing it, right? Would some people prefer the farmer, even though it's the same video at the end, right? Does it change their perceptions and attitudes differently after they watch it, right? If it's from a farmer versus a mom blogger, no offense. You're a knowledgeable mom blogger, right? Versus other mom bloggers that we know out there, right? How does that change? How does that impact those? Okay. The last piece is just understanding more on the willingness to pay for animal products, right? Originally, we had AMR risk reducing practices labels. After this conversation, I think I've added in red more of a balanced responsible practices or best practice use, something along those lines, as we look at these, different labeling schemes, and I call them schemes, my apologies. But, what is the willingness to pay for these products? One thing I will come to note, and I'm kind of going off topic here a little bit, is we have other research out there about consumers' vote versus buying behavior, right? Has anybody heard of that? Right? What is it? I'm going to ask you, huh? They're different, right? Why? Right. It's a lot different standing in a voting booth, right? When you don't have any dollars on the table versus when you're actually in that grocery store, right? Cage-free eggs is the perfect example of this, right? We vote for one thing and we're actually buying something completely different, okay? And so there's research even on that. And so as we look at some of these, right, those are questions we have to ask, right? If we're looking at different labels, right, what are the other consequences of it, right? Are there unintended consequences? How will consumers perceive that, right? Those are all questions that we can start to raise as well as we move forward. I will point out real quick, we do have a few other questions in here that we haven't quite analyzed all the way. So just their understanding of use in food animals. And so we asked them, there's 3 questions about the use of antibiotics. One was on treating illness, one on preventing illness, and one on promoting growth. And those were asking about the prohibit, if they're allowed and regulated, allowed and unregulated, or I don't know. Most people are saying, I don't know, right? So they don't know what's the use in animal agriculture, right? Another one, again, about antibiotic use in food animals is what do you believe is the percentage of food animals that are given antibiotics to treat, prevent, or promote? Again, from the early statistics we've looked at, most don't know, right? Most don't understand, or that they're saying they don't know. So something to note is on some of that consumer information is a lot of them just don't know from what we're getting. All right. Sorry, I only had a cow up here. That's the only picture I had. But if any of you want to send me pork or chicken pictures, I would take them in a heartbeat.
Wow, Dr. Brooks, thank you for all of that. I'd like to listen to that just a couple more times because I'm still struggling getting my head all the way around everything you just talked about.
And I talk fast.
Thank you. No, I do too, so I'm right with you. So my first simple question is, do you have this written in a research paper somewhere? Can you point me to somewhere where I can kind of read and absorb this just a little bit more because I'm still absorbing?
Yes. So we have a proceedings paper that is out, and I can send that. Otherwise, the final document is in final preparations as soon as our grad student or a postdoc sends back his final piece. And so it'll be submitted for a journal. So,
Okay.
But we do have the proceedings paper that has some of the basic information.
So
in it.
yeah, could you work with NIAA and maybe get that sent out?
Yep.
That way?
Yes.
So that we could all have access. That would be awesome. Thank you,
Yes.
because that would allow me to process maybe just a bit more.
I understand.
Much
Yes.
appreciated.
It's the problem of them giving me an hour and 15 minutes. I can put a lot of information in.
Yeah, thanks. And, I would love to see that paper as well. But something interesting, as an economist, you show a little bit of the numbers of the cost of human health of AMR, right? Do you think that including that as part of your communication has more impact with the consumer, if they know the impact of AMR in animal agriculture or in the environment or whatever, if we have an economic value or an economic number, does it have more impact on getting our message across?
I would assume we did not include that in the survey here, but it's something we could look at, including. But at this time, we didn't have it in there. We do know, just from this, that information does push them one way or another. It does change their attitudes when they see that information. So I assume if you give those kind of economic numbers, it would highlight things. Does that answer your question? But no, they were not given any information to begin the survey. So we didn't tell them what antibiotics was, AMR, any of that. There's different research looking at, giving them information before they do stuff. And that's something we thought about as well.
Kate, you have a Slido question.
All right. So consumer behavior, right? Consumer behavior changes. Consumer behavior changes on a daily basis. I'll give you an example because we're all about storytelling. When I go grocery shopping by myself, I can read labels. I can look at prices. I can take my time. It's heaven. When I had 3 children under the age of 8, an 8-year-old, a 5-year-old, and an 18-month-old, by the way, they're all boys. I'm lucky to get everything on my grocery list, right? Because we walk in the door and they want a cookie that's on the other side. And then they're fighting, and then they're in and out of the cart, and then they're throwing stuff in, right? So all of those things, right, change, right? Things do change, and there are influences on how we make our decisions, right? This is our best way of gathering data at the moment, right? But every time we ask somebody a question, right, depending on the time of day, depending on the time of year, that can influence us, right? And the best way then is to try and calculate those and redo those surveys over time, right? But yes, political campaigns can have influences, right? We do have on some of the vote buy stuff that we've done, we've asked, who they voted for, in a political campaign just to see how that impacts things as well. So, but yes.
So just to follow on with what Lucas said, I think it's great to give folks information, giving them information that might frighten them or they can't act upon. So if you're giving them information about the cost and you're giving them information about, things that they don't feel they can act upon, I think that, this is just me, it may create more avoidance behavior. So I guess there's you have to be careful with giving information to say, this is really bad, we need to do something, and they go, what can I do? There's that too. So
They're
that's just
all
my
testable
comment.
hypotheses, right? And I think it changes, like I just said, depending on the time of year, what the consumer's doing, all of that changes for us, throughout time. And I think we had a conversation with the industry group I was talking about when we're creating communication, right? It's continually changing because there's new information out there, right? There's new ways the consumers are changing. There's different influences on us, right? And so that can impact our decisions as well.
Thank you for the presentation and information. I know we got a little off track in the middle, but I think those are important things to talk about and share our concerns. And with that said, is there any thought of going back and doing a similar study and focusing on the human side of this and the perceptions and thought process processes that come forward from that in the information that's gathered. Because as this group has shared, so many of the negative finger pointing and thoughts and processes are pointed at agriculture. But if we turn it around and take a look at the other side of the equation, if we're truly going to talk about a One Health approach, what is the belief, opinion, and thought of consumers, of the population base, if we share them similar information from the human medical side and the human medicine equation as it relates to antibiotic resistance? Because I would think the outcomes, or hope the outcomes, would be similar if the truly factual and accurate information were shared.
Right. No, excuse me. Again, this was a focus on, what do consumers know as far as the food side, but I completely agree. I think we talked about it yesterday or the day before. Funding's our biggest issue. But, we'd be happy to look at this again from another angle, because I honestly, originally this was going to look at the producer and the consumer, from the food and agriculture side. So far we've only kind of looked at that consumer side and have gone down that route. But I think, looking at it separately then again is, those different angles, the food side, the health side, even surveys that combine both of those, right? And how that impacts those changes. So no, I agree. Yes.
Again, I would appreciate the work and research that you've done and shared with us. I think it's really good. And I guess to continue the discussion, I think from my perspective as a veterinarian, we're undergoing a very major change or revolution with the veterinary feed directive and water administered antibiotics that are now completely under veterinary oversight for medically important products. And so I think it would be very important now to have this similar type of research from a consumer perspective, how important it is to them and their acceptance if they are given information that now all antibiotics are going to be under veterinary oversight with prescription or feed directives.
Yeah, no, I completely agree. We can, again, that's information giving to them and then seeing how it impacts those changes. So yes. Is that what? Yeah. It's, it's another hypothesis. Unfortunately, in a survey, this was a lengthy survey. Most IRI and them, please ask us that they're under 30-minute surveys, because time is of money and you start to lose people. We have things in here to make sure to stop them from just always saying A or C, I think was what we were taught in school, is always pick C, right? So we have things in there to try and stop those things from happening, but you have to be careful with lengths of surveys. So like any trial, we only can look at one thing at a time a lot of times.
Thanks. That was really interesting. So there certainly are papers that have been written on perceptions of human patients and what they, and also I think that if there's a higher awareness of whether antibiotics work or not, they expect different things from their prescribers. And so some of that work has been done. So maybe reviewing that and thinking about how you could incorporate that would be helpful. But I just was wondering along the lines of the last comment, not so much about the content that's provided, but about the sort of the positive versus negative delivery. So just wondering if you have any understanding of how a video that is presented as, this is a problem, we need to do X, Y, Z, as opposed to a video or information that's presented as veterinarians and producers are working together to impact this problem. A lot of progress has been sort of just the positive versus negative.
Yeah. As far as specific on antibiotic use, antimicrobial resistance, One Health, I don't know any studies that have looked at that as far as the positive versus negative. There's still, like you said, there's some research done on the health side, not as much done on the livestock, animal food agriculture side. But yes, there are other studies on other topics looking at positivity versus negativity. Most consumers tend to pull that negative information more than we pull that positive information. And so positive reinforcement sometimes takes a lot more than just one negative comment. And so there is some research literature on that, just not specific to antibiotic use in AMR.
If there's more power or potential power in focusing on negatives, is it helpful to bring up some perhaps unintended consequences of what the consumer thinks he or she wants, as part of that conversation? If people are, pulling more from the negative, So instead of focusing on the negative of AMR, for example, focusing on some of the potential impacts to animal health and welfare with sort of extreme black and white implementation of antibiotic use rules and things like that.
I'm going to go back to Michael. I think it depends on what our goals are, right? What is our goal? And that should, hopefully influence us to what we're trying to do and say. Is that, I think that would probably be, what is our goal? What is our message? What are we trying to show? And then how do we go about that to make those goals?
I want to appreciate what you've done here, because I think what you presented, which is a nice companion piece to what Dr. Dahlstrom presented, really brings us to an understanding of what we've heard over the last day and a half. One of the things that struck me about the video is that the bugs look nothing like bacteria. They were drawn, at least at one point, to look more like insects or spiders, which to Mike Dahlstrom's point is very peripheral. I mean, that's going to, because we know what that image does, it immediately prompts a certain revulsion in people. I mean, just the way that those were drawn makes you feel differently about what you're seeing. It's a very subtle kind of thing that it does. So I think one of the lessons is that not only is the science complex and very difficult to understand, but the whole issue of communication and how we communicate to people and what we communicate, and we heard some of that in the conversation here, itself is extremely complex. So you have two areas that are just dramatically complex, and that's why perhaps we're all having so much trouble communicating with this issue and breaking through to help people understand. So I think we've got a lot to build on coming out of this meeting, and I really appreciate what you and Michael have done, because I think it encapsulates the challenge ahead of us and what Paul and NIAA and the NAMRI people, there's a lot to build on here, and I'm not sure what the next stage is. And maybe actually if Paul's talking next, so maybe he'll explain it to us.
All the answers. Well, thank you. And that's, the complexity of it, like you just said, how many else saw spiders? Ticks? You know what? It reminded me of Natari, the video games? That's what it reminded me of. So even in that instance, it reminded all of us of something different and how we connect to that. And so again, who is our audience, right? Who's going to watch it? And unfortunately, when we publish something on the website, we don't know who's going to be that target audience, right? With social media and everything, we never know directly. It's not like we're sitting in a group and I know who you guys all are and how to maybe present things differently versus submitting something on the website, and that everybody's going to look at it slightly different. So, no, good points. Thank you.